Hi everyone, I'm GREYMOND. Today we're going to be talking about OCD recovery and answering your questions. So the questions were the ones that you left below my videos, and let's get started. First question is, does a person develop OCD from surroundings or is it genetic? I would say I don't find it to be genetic. Most people who have OCD who come to me, they don't have anybody in their family who has OCD. I would say maybe 20% of the time I see that. Maybe, 10-20% of the time, not more than that. Personally, when I developed OCD, nobody in my family heard about it. So it's not that common for multiple people in the family to have OCD. So no, I don't find it to be genetic. In terms of surroundings, I do think that surroundings can cause an onset of OCD. So say, for example, if you're going through something stressful in your life, I do find that, especially if it's in that age group of 18, 19, 20, this is where people most often develop OCD, their first kind of OCD situation, and then it just kind of goes on from there, and it can switch from there, but the first one is usually around that age. So I do think that if during that time there's a lot of pressure put on the person, even if it's just, something that everybody else deals with, such as school, social life, that kind of a thing, I do still think that, that can cause OCD. So stress happens, and then boom, some thought comes in, the person starts to react, and then OCD kind of goes from there. I do think that that's valid, but at the same time, I can't really tell you that if, say, that person 18, 19, 20 years old, right? Sometimes I actually see it younger as well, but usually that's, I would say, again, 80% of the time that is the group. And I also see it when people develop it a lot older as well, but most of the time it's in that kind of group. And I would say that if the person was not facing stress in that time, they would still develop OCD. I don't think that no matter what your situation is, unless it's extreme, really, your surroundings would not change your getting OCD or not. I think you're more predetermined since birth to get OCD. And this leads into the next question is, could anyone develop OCD? And I don't think so, because I've talked to, as you know, a lot of people doing this for years and years. And everybody who I've talked to is very nice, very sensitive, almost too nice, almost too sensitive. That's a trait that's very, I would say, you can't say kind of talking in absolutes 100% of the time, but I would say really 95% of the time, 99% of the time, I really can't think of anybody who wasn't nice. And considering how many clients I've had in the past, you would think somebody would be not nice, but everybody's been really nice. So I find that that's just a common trait that people with OCD share, and I think that that's the trait that sensitivity is what creates it like a perfect ground for developing OCD. A person who doesn't care, who is not very sensitive, they're just not likely to get OCD. That's not to say that they won't develop some other problem, but OCD, they're just not very likely to get it. So from that perspective, I don't think anybody can develop it. What causes OCD? Like I said, I do think that the brain is kind of set up from birth a certain way to have it. There's some research that shows things like strep throat can cause OCD. I don't know if that's true or not, but it's when I talk to clients, I don't focus that much on what caused the development of OCD, because at this point, years and years later, decades later, it doesn't really matter. You're stuck on a thought. You need to get out of this thought. When that thought your brain tries to replace it with a new thought, we need to show your brain that everything is fine, so you don't develop a new thought and a new thought and a new thought, and you just get out of it. And I can tell you the brain recovers 100%. So it doesn't matter how old you are. If you put effort into it, you recover. I see it all the time. Most of my clients recover, right? So, and the rate of it just depends on, how bad the person is feeling when they start the recovery. But it's like going from point A to point B. Some people run, some people walk, some people crawl. Some people's distance from point A to point B is longer just because of, how bad the situation got. Some is shorter. And by the same token as well is, sometimes the distance is very short, but the person is crawling to it because of how scared they are, and they're just unable to go any faster because the fear is paralyzing them. And so, and then if you compare, that little distance that the person is crawling through, and then another person who has a very large distance, but they're just running through it, that person who has more ground to gain will actually recover faster because of how much effort they're putting in. Not maybe effort is not the right word, but how much, because both people are putting in effort, but it's more how much progress they're making quickly. So it's just about doing it. If you had OCD for years, decades, it doesn't really matter. It really doesn't. It's what you do right now from this point on. That's what really matters. If you start to work on yourself and work on recovery, you will recover. I promise you that. If you do nothing, if you feel scared, everybody feels scared. OCD gives you panic. OCD gives you anxiety. That's a given. But what you do with it, if you kind of step over it and say, it doesn't matter, I'm not doing any more rituals, I'm not doing any more analyzing, checking, trying to figure out, I'm not doing that. The more you do that, the more you push through, the less the less OCD can get you, and then you just pull out of it. You slowly recover. So next question is, hey Ali, have you ever helped someone get over HOCD? If so, how? Yeah, HOCD is not different than any other type of OCD. Of course, I've had many clients with HOCD. I've had many clients with probably every type of OCD because they're pretty repetitive. So this is a very common type. How? Again, the same thing, with HOCD is the person is usually afraid of, what if I'm gay, right? So any kind of thing that triggers, right, such as seeing a good-looking person will be a trigger, or hearing something about this topic might trigger, or just anything that really triggers you. Refuse to run away from it, refuse to avoid, refuse to analyze, refuse to kind of protect yourself. Just say, okay, whatever, my brain is saying whatever, I don't care. I'm not listening to this anymore, and you will see that these thoughts will start to go away, so just don't react to it as anything important, HOCD, sometimes HOCD is also classified as harm OCD. So if you're talking about harm OCD, again, it's the same process. Thought comes in, well, I'm going to kill somebody, or I'm going to kill myself, or, whatever, right? Don't react. Don't respond. Keep on going. The more you keep going, the better you're going to feel. But you have to, right now, as you're recovering, you have to step over that fear, step over that anxiety, and refuse to analyze. Because it's the more you react with fear, which is what you do when you analyze, the more this kind of process keeps going. Next question is, hi Ali, so every time a thought comes in about germs or harm, or did I turn the stove off, I say no. Is this the right approach? Every single time it comes back, even if it's 30 seconds and my mind wants to solve and check again, I say no, I'm done with this. That's exactly the right approach. You just said what I just said. That's exactly what you need to be doing, just over and over again. Nope, not doing this. That comes in again. Nope, still not doing this. And eventually it will stop. Sometimes a lot of my themes will be triggered at the same time, like a snowball effect, and my brain just wants to badly figure it out and make sure it's okay and check again and replay the events. These are the hardest ones to disregard because there's so much going on at once and my brain just wants to solve it. It's hard. Try to prepare yourself before you go into situations that usually trigger you, that, okay, I might get a thought. When I do, I'm not going to react. I'm not going to pay attention. Then you get the thought, refuse reaction, and just keep going like that. I have been working hard choosing to refuse, but sometimes a thought just keeps coming back in. So do I continue to say no until my brain gets used to me being in control, even if it's very anxiety producing? Yes. Just keep going. Keep saying, nope, not dealing with this, even though the anxiety is going to be pretty high, because the brain is going to try to pull all the stops in order to get you to react. So that's normal. There's nothing wrong with that. You just have to keep going, Every time you give fear, it's, what we were saying, that road to recovery from point A to point B. Now you're taking a step back. Every time you react with fear, you take a step back. So you can't allow yourself to do that. Just not sure. The most effective method, I keep saying no, but it keeps cycling back in my brain to solve or think about it. Any tips? Okay, so the reason why it cycles back is because before you taught it that this is dangerous. The way OCD works, as you guys probably heard me say a million times, is the more you react to something, the more you say to your mind, this is very important to me, the more that part of the mind, which has no idea what the thoughts are or what it means or the story behind it, it just understands this type of signal, and that's all it is to your mind. It's not a thought, it's not, whatever type of OCD, it's just a signal. So this signal you're reacting to. Okay, if you're reacting to it, how are you reacting to it? So just the act of reacting to something means it's important. Okay, how are you reacting to it? Oh, with fear you're reacting to it. That means it's dangerous. So now it sends you the thought with fear automatically. So you reacted with fear, but now automatic fear comes in. So you have to disregard the automatic fear and keep saying, nope, doesn't matter. I reacted the wrong way. It doesn't matter. I'm not doing this anymore. And after a while of doing this repetitive thing of just trying to send you all kinds of, scary thoughts on the same topic or similar topics, or cycling between 2 or 3 OCD themes, it will see that you're not reacting, nothing dangerous is happening, and I promise you it will stop. So it just takes a little bit of time. What's the difference between ERP and analyzing in religious OCD? And how do you do ERP for this type of OCD? Thank you. So for religious OCD, usually, and again, just because I talk to people all day long, so I know pretty much most, types of OCD I've heard a million times. So in terms of religious OCD, the most common things that happen, and this kind of depends on your specific situation, but it's during prayer the person will have a bad thought and they have to re-pray, or the thought will come in that I have to do something, and if I don't do something that I don't care about my God or whatever, so those kinds of things, or I have to do something a certain number of times, or I don't care about God, or I have to wear certain colors, go to certain places, avoid certain places. So with religious OCD, I find there's a lot of compulsions, of physical compulsions that go along with it. When you think of religious OCD, you would probably think of more like a Puro type, but it's really not. I find, not maybe for some people, but for a large group of people, there's a lot of physical compulsions that also go along with it. And all of it is pretty common. So how do you do ERP for this OCD? So when you get this thought of, I have to repray, I've prayed wrong, I have to repray, or I have to do this a certain number of times, or something bad's going to happen. I find that OCD kind of intertwines a lot with magical thinking OCD, where you think that like these numbers are good and these numbers are bad and these colors are bad, and if I use these numbers or these colors, then something bad is going to happen to somebody. But with religious OCD, it's intertwined into religion rather than with just magical thinking OCD. It's more like one of the loved ones is going to have something bad happen to them. So they're kind of a little bit different, but also very, very similar. So when that thought comes in that I have to do it a certain way, you have to say, no, I'm not doing it. And even as you get braver, you can try to do the opposite. So before, for example, a lot of people avoid the color red. Actually, I'm wearing red too right now, because it's like the color of like blood or just negative, like they find it to be aggressive color or negative color. Also black, a lot of people avoid black color. So wearing those colors on purpose, just to say to OCD, doesn't matter, I'm gonna wear it, I don't care. Or sometimes there's also certain situations or clothes or numbers associated with something bad, and people choose to not use them. So using them on purpose. Basically, whatever OCD tells you not to do, that nobody else would follow, you're not following it anymore. So if OCD tells you, oh, you have to do it a certain way, nope, not doing it, going to do it the opposite way. And it will feel really bad at first. You will feel very anxious. It's fine. It's normal. I promise you it will pass. It's just right now, that's what it is. Next question is, I am 36-year-old male that has harm OCD pop out of nowhere. After 3 months or so of complete hell, I figured it out thanks to your videos and talking to a great psychiatrist. I'm always so happy when people say that they found a good psychiatrist. Honestly, it warms my heart. You're very lucky. My thoughts have gone down greatly, and I have been fighting it hard for about 2 months now. My question is it normal to still have the tight chest and medium anxiety all day? I never really experienced anxiety much before this, so it's very different for me. Is this something that slowly will lift as I continue to ignore the thoughts and push forward? I would say that definitely it's something that will lift. The only thing I would really kind of stress is don't try to analyze this. How am I feeling? Am I feeling like, do I have tightness in my chest? How do I feel? Because the more you try to figure it out, the more the anxiety, even though this is a real kind of symptom, that part of the brain, it doesn't understand OCD, and it doesn't understand the difference between real life fear stress and OCD type of stress. So I find that as the person, just like what you're doing right now, that you have you are doing so good and you have gone through a big part of it, and a lot of the times closer towards the end of the recovery, the person will be like, well, I'm still getting a thought every once in a while, and then they start to focus on it very much, so almost like another theme. So and you have to let go, so you have to let go of the recovery process as something you worry about. You've gone this far, you just have to finish the job. You don't have to specifically worry about it, just keep an eye on it, because you do have to keep an eye on your progress, but not from a position of fear is what I'm saying. Only from a position of power. So you want to say, I'm doing fine, doing better than last week, good. And if say you're in a situation where you're not doing better than last week, then kind of analyze it, but from a position of OCD recovery, not from a position of fear, not from a position of analyzing out of panic, like trying to solve the thought, but just, well, what did I do? Oh, okay, yeah, I was seeking reassurance there, then, I got it stressed out here, and that's what caused it. Okay, I understand, now I'm choosing to move on. So all that happens from a position of power. So that's the only thing I would stress, but these physical symptoms are common, and they're going to go away on their own. Just don't focus on it so much. Next question is, since I developed false memory OCD, I haven't felt like myself at all. I feel as though my reality and atmosphere has changed or something. Is this something you've seen before, and is this common feeling people suffering from OCD feel? Yes, and it's not only with false memory OCD, it's really with any type of OCD, because you're so focused in your thoughts, you're not kind of in real life, you're kind of stuck in your own head, so everything else seems like a blur almost. That feeling will pass. It's just like I was talking about physical symptoms, this is kind of another aspect of it. Next question is, I have HIV contamination OCD. When I go outside, I'm always looking around to see if there are any men that look like they might have HIV. Or fall into the groups that more likely can have HIV. If I see them, I turn and run away. This makes shopping very difficult as I see them almost everywhere. Can you help? So I would say that what you're doing is avoidance and a compulsion. So you have to do things just like everybody else is doing. You're shopping, right? You're not running away, you're doing what you came to do, and you're leaving, so you're not doing anything in any differently. Same with washing hands too much, checking, analyzing, going to the doctor, doing HIV tests. You're not doing any of that. You're just saying, whatever, I don't care, I'm not doing this, because the more you allow yourself to get further analyzing this, to avoiding this, trying to figure out to make sure you're safe, the worse this is going to get. So don't do this anymore. I've recently started struggling with intrusive thoughts, only 2 so far, same theme though, and I get scared that they're memories. I try so hard to remember if it actually happened, and I don't have memory of it, but the what if keeps looping. So because you're trying too hard to remember, your mind sees your fear and just sends you more thoughts. That's what's happening. So you're stuck in that loop. And the mind can't stop the loop. The only one who can stop the loop is you, so you have to stop engaging it. I started trying to do what you said to do in your false memory videos, and I was wondering if it's normal to still feel the anxiety in your stomach, even when you actively choose not to think about the thought. Yes, because just because you're not thinking about the anxiety, it doesn't instantly make it go away. It's the reason why it's there is because before you reacted. So it will take some time, just like we were talking with physical symptoms, with the previous questions, it will take some time for them to go away. As your anxiety lowers, over time, as that part of the mind kind of reassures itself that everything is fine because nothing is happening, the anxiety will lower and everything will be fine. It's like I still can feel some negativity or anxiety in my gut, and I can feel the thoughts in the side of my mind. Yeah, so that's gonna happen. You just have to keep going. Can you please explain the recovery of self-harm, suicide, OCD? I keep disregarding and telling myself I'm not dealing with the thoughts, triggers, and it's getting a little better. I'd say a 3 out of 10 anxiety level. Thank you. Hashtag keep pushing. Yeah, exactly. Keep pushing. I think you're fine. You're doing good. Try to do more exposures on purpose. Really hit it with, so say, for example, self-harm. So you're, depending on how your thoughts go. So say, for example, sitting with a knife, those kinds of things, and from a position of power. So here, I can sit with a knife for 5 minutes and I don't care. And then the thoughts are going to come in. You're disregarding the thoughts. Then you say, I would do one of those exposures in the morning, one in the evening, as many as you can get. The more of them you get, the better, because you have to convince your brain that everything is fine through exposures. So the more exposures, the faster you go down this road of recovery. So things like that. So you're not avoiding when kind of organically triggers happen, and you're doing more triggers on purpose. I have bureau of how anything is happening, or how words come and how emotions come in human beings. It's happening every single moment, and even at communication time, making me anxious over and over. How do I apply ERP and other recovery treatment? So for that, because the thoughts are coming all the time, it's what you're doing with the thoughts. You're reacting with fear to the thoughts, and that's where they keep coming in. You want to react differently. So the thought comes in. This is just my theme. Doesn't matter. My theme, I don't care. And you'll see it will start to lift. The good thing is that they are coming all the time, so you are getting a lot of practice, but I think just your reaction needs to be a lot better. Question, is it possible that when you start to resist compulsions, your bureau also diminishes? Like you can see things in a more logical and clearer way with only little anxiety. This happened to me pretty much in a day or two. Yes. See, your logic, you know how a lot of the times everybody with OCD, everybody around you, like around the person who has OCD, will tell them, why are you buying into this? This doesn't even make sense. Why are you worried about this? This is silly. And the person with OCD doesn't see it that way. It's not because they're not understanding logic. They have logic, and it's clouded by feelings. So as the feelings lift, as the anxiety goes away, the logic remains. So it's kind of like a clouded window, you know what I mean? So it's or a fogged up window, right? So the fog goes, and you can see things clearly, just like everybody else sees them. And yeah, if you push really hard, that that happens pretty fast. Also, when you are very much stuck in your thoughts, the anxiety is so strong, it's very, very hard to react properly as well. So, because you're stuck in so much fear. So that may be causing that fogginess and, not seeing things in a clear way. As you get through it, then you feel better, you see things clearer. That was my last question. If you would like to do the recovery program, all the information is on youhaveocd.com. You can also schedule an appointment with me through there. Thank you so much for watching. Please subscribe. I'll see you in the next video.